Let's talk about doctors. They're being balloted for strike action right now over demand for a 29% pay rise. Nice work if you can get it. The healthcare workers, now known as resident doctors, not junior doctors. I think resident doctors are far more representative of the level of skill they've got. They're asking for that pay rise on top of the 5.4% this year. Comes on the back of a 22% increase last summer, although that covered 2 years and was backdated. But they have been claiming that they are a lot worse off since the austerity years under the Tories, and they're still trying to make up their missing salaries. Meanwhile, a new report out from the Nuffield Health Trust has said that actually junior doctors are better off now than they were a decade ago. So which is true? Well, let's ask resident Dr. Bhasha Mukherjee, who joins us right now. Good morning to you, Bhasha.
Good morning, Julia.
Thanks for joining us. So I don't understand. I mean, we know what your salaries are in terms of, different pay rates for different skill levels and the like. We know how much they've gone up or not gone up. How is it possible to have one group saying, oh, we're worse off, and the other group saying, oh, no, they're much better off? Which is true?
I think the question here is that the state of the NHS at present, and you would agree that it's really difficult to get an appointment with GPs. I have patients who come in and consistently say how difficult it was to get an appointment. And as a result, they're coming in with 3, 4, 5 problems in a 10-minute appointment. They are struggling to get appointments at secondary care. The waiting lists have started going up again as of March. So overarchingly, the NHS is becoming a much more difficult place to work at. And there are better avenues that doctors are defecting to, including private health, other countries, and this is what we need to stop the NHS just falling on his knees. We just need to stop this mass exodus of doctors, essentially.
Right, that was a lovely answer. Would you now like to answer the question I asked you?
You'd have to repeat your question.
Oh, sorry. Apologies for that. How is it possible that the Nuffield Trust is saying that you are better off than you were 10 years ago, but the BMA on your behalf, and again, bearing in mind, you talked a lot there about GPs. You're a resident doctor. You work in a hospital. You don't work in a GP surgery. We're not talking about GPs. GPs are doing just fine, thank you. The ones who can actually get a job. Plenty of people are being trained to be GPs and they're not able to get a job, which is madness in itself. But how come the Nuffield Trust thinks you're better off than you were 10 years ago, and the BMA, your representative union, thinks you're worse off?
I can't speak for the Nuffield Trust, what they've, who they've questioned, but what I can say is that although you might think that resident doctors are only in hospitals, but actually lots of resident doctors do work in GP, I being one of them. I can definitely speak for my time in hospitals as well. The picture is much the same. I can only speak for the people that are represented by the BMA, and that is a large majority of resident doctors or junior doctors. And the ones that work in the NHS, what we can say is that when you compare with what we can afford with the money that we are paid with, which is essentially inflation taking into consideration, the money doesn't stretch very far. Well, we are unable to afford housing. We're unable to afford daily living. We're having to have side jobs.
Hold on. So do you mind? I haven't got the exact figures here on what each person is earning. I'm of the view that doctors who got, load of grade A levels in hard subjects and 7 years of training and then working as a resident should be paid very well, and certainly a damn sight more than a train driver on 70 grand. I know you're not on a high pay as resident doctors. GPs, consultants, yes, but most resident doctors, I think, are not paid adequately for their skill set. However, there are plenty of people who earn far less than you who are perfectly capable of affording to rent or buy a home and to live their lives. So that's just an abject nonsense.
But it's a question of what else is out there. The truth is that we are having so many doctors leaving the NHS because the prospects are better if they move on to private health or if they move to other countries. And that is what we need to stop.
We have a problem with retention. We have a problem with recruitment. And I think part of that may be money related. It's also down to the sort of trials and tribulations of the jobs itself. However, the vast majority of people who train as doctors in this country are not sodding off to New Zealand or Canada to work. And they're not going into private. There's only so much work in the private healthcare service. Most people who work in the private healthcare actually work in the NHS as well. I had a family member offered a cataract operation in 6 months' time. Oh, but you can have it on Friday if you go privately. I mean, maybe if that NHS consultant did a bit more work in the health service, she wouldn't have had to wait that long on the NHS. But the Nuffield Trust, a health think tank, they know what they're talking about. This is literally what they do for a living. They say that the BMA, when they claim they're poorer now than 10 years ago, that's because they're using the RPI measure of inflation as opposed to the CPI, the Consumer Price Index, which is a measure of inflation. You're talking about, real terms, income. And if you compare the rise in prices in the last 10 years, she said, the reporter the researcher from the Nuffield Trust, Lucinda Rolowich, says that actually doctors are 8% better off than they were a decade ago. Not, as they claim, the BMA, 22% worse off.
So, I mean, it is not just about the money.
Oh, I thought it was all about the money a minute ago.
The money goes a long way. The money, if we do manage to retain more staff, recruit more staff, we know that that is going to make a huge difference to the condition of working for the current.
So what else is it then?
It's overall, the emphasis being on valuing the staff and retaining the staff so that the NHS looks different than it is.
What do I say? Valuing the staff. Do you not feel valued? I mean, we came out and we did that for you every Thursday for months. We banged on pots. People are constantly thanking you. You're like the 8 nurses and doctors in the NHS are sort of given a sort of saint-like aura, as if you're doing it out of the goodness of your hearts, as opposed to a paid job. But I mean, do you really not feel valued enough? I mean, you try being a journalist or an estate agent or a lawyer. They're not really valued.
No, for sure. All jobs, that you've mentioned today, they are difficult. But it's really difficult.
Oh no, I'm not. No, I'm not crying. I'm saying we're not valued. We cope. Do you need to, what would make you feel valued? Do you want people coming up to you and just sort of hugging you in the street? What do you want?
If you ask me personally, if there were more doctors across the board to share the load, and if there was better staffing levels on any given day, so that our patients would be feeling less, unhappy with our services, the service that I personally deliver, I wish I could deliver a better standard of service.
You could do your job better, and a lot of people in the healthcare sector. So why, if given that the NHS budget has gone up hugely under COVID and since COVID, but we've actually interestingly seen fewer operations, fewer treatments carried out despite all that extra money. Productivity has gone down. Why is that? Why are the wrong people being hired? Are we spending too much on HR and DEI staff who are paid more than you, or is there a problem of another kind?
I think it's multifactorial, and I will say staff retention is a big part of it, because continuity is a big part of delivering good level of care. And unfortunately, from my experience in working in the hospitals, staffing levels were always undermet, and that meant that you're seeing a new doctor each time. I work in a GP surgery, and I see patients all the time who complain, I have to tell my story again, and we're wasting more time in just repeating these stories rather than actually. That's a
management issue at the GP surgery, though, isn't it?
I think it's across the board.
GPs working part-time, not full-time.
Well, this is the point. People who are not actually, maybe leaving the NHS, they're finding other ways to cope, and that means actually taking more time off work.
Well, also GPs are now paid so much they can afford to work part-time.
Well, I know a lot of GPs, for one, that are actually also doing side hustles. Wait a minute,
they're so stressed and but they've also got another job. I mean, as you can hear the music, the music that tells us the time is against us. But Bhasha Mukherjee, who's a resident doctor, very much appreciate you joining us.